Hey, welcome back. This is Dr. David Cruz with Whitecoat Medicine Talks. Today we're going to talk about a topic that I guess I ran into last night. I was up late last night, maybe about 3 or 4 in the morning, and I was reading a post that was on WebMD by Jambo6, and he was stating all his symptoms and how doctors had difficulty telling them exactly what was going on, and finally they figured it out. And it was a easy fix. However, I think that this is something that is very important for you guys to know about, and so I decided to talk about it today. You know, I'm always telling you guys about how important it is to know about your medications, to know what you're taking, to know why you're taking it, not just decide to take supplements just to take it, or not take medications just to take them. You should know how they work, what effect they can have with other medications, and what effect it's having in your body. So with that being said, let's jump into this topic, which is about magnesium, a very common over-the-counter supplement you can take, but let's figure out what it does and why it does it, and let's talk about that now. So now I think for most people, they consider magnesium as a medication to help them have a normal bowel movement. And yes, it's used for that, but there's other uses for it as well. Many times your doctor is going to give you magnesium because they see that in your labs your magnesium level is low, and so they'll replace that for you. Now, a lot of times they'll give it for other reasons as well, and we'll get into those. In the hospital, we give a different type of magnesium sulfate, which will help females that are pregnant that may have seizures stop from having seizures, which is called preeclampsia. And we also give it in different heart conditions as well, or in cardiac arrest. So we do have different uses for magnesium, and we'll get into that a little bit. So how does magnesium work in your body? Well, it works basically to prevent the release of acetylcholine at the end plates. Now, the end plates are where your nerves meet your muscle, and so that your muscles can start contracting. So what we do is magnesium stops the release of acetylcholine, so therefore your muscles don't contract. This is important to know what some of the uses will be for magnesium as we go on in this talk. So another effect of magnesium is it decreases the electrical conduction that goes on in your heart. So it kind of slows down your heart rate as well and relaxes your muscles as well. Now, the other thing, it does cause more retention of fluid in your intestines, and therefore, yes, you can use it to have a better bowel movement as well. So now let's move on into the major point of this whole talk, is what happens when your magnesium levels are too low. Well, a lot of times what we see is that your magnesium levels go low, then your potassium levels come down, and so do your calcium levels. So the calcium may be moving into the cells. As the calcium moves into the cells, you're going to get more excitation of these cells, especially your nerve cells, and therefore you start getting twitching and cramping. So sometimes you can even get seizures as well. So what we see a lot of times when your magnesium level is low is twitching and cramping as well. And these are the symptoms that Jambo6 was feeling. He was feeling a lot of twitching, and nobody could tell him what was going on. Finally, one of the doctors let him know to take some magnesium, and within a couple of days, that helped him. So that's one of the main topics that we are covering today. Now, going along with your twitching and cramping, a lot of times you can get fatigue or muscle weakness as well, and that's another sign of your magnesium level being low. Now, remember that not all twitching and not all cramping and not all weakness is due to magnesium levels, so don't just replace it just because. I think it's very important to go to your doctor, try to get a level so that you can know what you're treating, and even if your levels are somewhat, maybe a little low or just right about normal, maybe you can take a little magnesium and that may help you as well, but check with your doctor first. Now, sometimes when your magnesium level is low, your blood pressure may be higher as well, and you also worry about irregular heartbeats and heart rates. And so a lot of times I give magnesium to my cardiac patients as well because it does help them. We have to be careful with the medications we give, but we do check levels and do it that way. Now, sometimes it can be associated with emotional problems as well, maybe depression, I would possibly ask your doctor to do a blood level for you at those times as well. And it can also affect a couple of other things. Asthmatics may have a lower magnesium level, which will make it worse for them to breathe, and so replacing that may help them. In addition, it may make osteoporosis worse. Magnesium is stored in the bones as well. However, because if you have a low magnesium, the calcium roles are changed a little bit, and so you may worsen your osteoporosis as well. So in addition to taking your other medications for osteoporosis, such as Fosamax or calcium and vitamin D, magnesium may help as well on that. So now, very important to know, what happens when your magnesium level is too high? Well, you can cause depression of your nervous system, you can cause a heart block, you can get respiratory arrest, and die as well. So we have to be very cautious with taking magnesium. Usually we take a little bit of magnesium, it should be fine, but check with your doctor first. As I mentioned earlier, it's very important that your kidneys be working well, because that is how you eliminate the extra magnesium from your body. And so if you can make sure that your kidneys are working well, and check with your doctor, let them know when you are taking supplementation of magnesium level, because they will want to check those levels as well for you. Now, how do you get some magnesium in your body? Certain foods have a lot of magnesium. You can look that up, definitely. But almonds, avocados, bananas, spinach all have a lot of magnesium level in them, and you can replace it in that route. Or you can take an over-the-counter supplement that they sell. Usually your doctor will give you magnesium oxide, 400 milligrams once a day, and that will help you. Now, I usually, when I give it to patients, I give it to them for about 2 weeks, and then I stop it, and just to see how they do, if they feel better, see if some of their twitching went away, their cramping went away, and see how they feel overall. Sometimes they feel a lot better, sometimes it makes no difference. And that's why it's important to know that not everything that twitches or is cramping is because of your magnesium level. Other levels have to be checked, your calcium, your potassium, and other neurological problems have to be examined to make sure that there's not something else going on with you. Thank you so much for Jambo6 posting that. I appreciate that. It helped me get this talk out and to my patients and to everybody out there. I hope you all learned something today, and we will see you next time. Take care.